TB is one of the top causes of death in children worldwide. More than 51,000 people died of TB in South Africa in 2021 alone. There is new hope, though, that figure could be reduced because a new clinical trial conducted by researchers at Stellenbosch University have found the first ever safe and effective treatment to prevent multi-drug resistant TB in adults and children. The clinical team found that it greatly reduces the risk of developing multi-drug resistant TB in communities with a high disease burden.
This trial, VQuin, and the pediatric trial, TB Chump, we jointly presented these data at the big TB conference in Paris now. And in fact, both trials have found the similar results in that we can protect people developing drug-resistant TB by at least 60%. So it's 60% effective, which is great. And it's extremely safe, and even safer in kids than in adults.
While the pediatric trial was carried out in 5 provinces around South Africa, the adult trial was carried out simultaneously in Vietnam. The South African study found that they now have a safe way to protect children in a household where an adult has multi-drug resistant TB. This first of its kind evidence into the prevention of drug-resistant TB has the potential to protect millions of lives from the debilitating disease. And the antibiotic levofloxacin is already in use to treat a variety of illnesses and will be a new weapon in the fight to prevent drug-resistant TB.
Well, it has been used for prevention therapy in small observational studies, but it's not been used in a big kind of clinical trial like this. But it has been used to treat disease. But it's also an antibiotic that's used very commonly to treat other infections in children, so pneumonias, ear infections, other bacterial infections in children. So it's certainly not a new antibiotic, and it is licensed and it's registered.
For now, much of the data in the clinical studies is being shared within the medical profession, so that all healthcare providers may equip themselves with the tools necessary to decrease South Africa's high rates of TB. Travis Andrews, CGTN, Cape Town.